DCIS of breast, there is a ductal carcinoma in situ. So this the age group is around 54 to 58, that is more than the compared to the LSIS. And looking at the incidence is again more, it is about 5 to 10%, whereas in case of LCIS it was about 2 to 5%. Now looking at the clinical signs. Clinical signs, if you see, it is basically asymptomatic. It can be asymptomatic, but the mass, the pain, the nipple discharge may also be seen. So what is seen is the mass can be seen, the pain can be seen, the nipple discharge can also be seen. Now if you look at the mammographic signs, it involves the microcalcification. The microcalcification is seen. Next, we are looking at the premenopausal. And premenopausal, it is about 1/3. Now looking at the incidence of the synchronous invasive carcinoma. The incidence of the synchronous invasive carcinoma, if you see this, it is about the 2 to around 45%. And looking at the multi-centrability, it has a wide range, about 40 to 80%. Now looking at the bilaterality, it is about 20%. Now looking at axillary metastasis. So basically bilaterality, it was more in case of the LSIS, whereas in case of DCIS, it is 10 to 20%. Whereas in case of the LCIS, what we saw, it was about 50 to 70%. Now looking at the axillary metastasis is again the similar one, that is LCIS was 1%, this is also about 1% in DCIS. Now looking at the subsequent carcinomas. In case of subsequent carcinomas, this DCIS incidence is about the 25 to 70% of the subsequent carcinomas. And then looking at the laterality, it is basically it is mostly ipsilateral, whereas the LCIS was bilateral. Now looking at the interval to the diagnosis. Interval to the diagnosis is about 5 to 10 years, whereas in case of the LCIS, it was about 15 to 20 years. Now looking at the histological type. It is again ductal. In DCIS, it was ductal, whereas even in LCIS, it was ductal.